Hello again, everyone. Today I'm going to be talking about the various obstetric emergencies that can happen. What are their signs and symptoms, their treatment, and any nursing interventions. I did make a chart for this and I will upload it with this video so you can take a look. So the first one I'm going to be talking about is cord prolapse, and that's when the umbilical cord protrudes alongside or ahead of the presenting part of the fetus. Signs and symptoms can include visualization or palpation of the umbilical cord, PROM, which is the premature rupture of the membranes. A sign could also be like if there's multiple gestations, excessive amniotic fluid, if the fetus has changed its station or it's in like a breech presentation, abnormal fetal heart rate where you'll see bradycardia, and premature birth. Treatment includes immediate delivery, whether by vaginal or by cesarean section, administer O2 if ordered, apply a fetal monitor, manually elevate the presenting part to reduce cord compression. Another option is to consider tachylysis if delivery is not imminently available. So that could help basically stop contractions. Also, verify that the presenting part is well applied to the cervix and engaged into the pelvis. Nursing interventions can include changing the woman's position to the knee-chest position, Trendelenburg, or to a modified Sims. You don't want to try and replace the cord into the uterus. You want to monitor fetal heart rate, have the mother maintain bed rest, and provide emotional support and explain exactly what is happening to help ease any fear and anxiety. Next is placental abruption, and that's when the placenta separates from the inner wall of the uterus before birth. Some of the signs and symptoms include gestational hypertension, seizures, uterine contractions, often one right after the other, uterine tenderness or rigidity, vaginal bleeding, pain in the abdomen, blood in the amniotic fluid. The mother may feel faint. She may be having some cramping. She may report not feeling the baby move as much as before, and back pain. Treatment includes blood and urine tests, an ultrasound, hospitalization for close monitoring if the abruption is mild, betamethasone to mature the fetus's lungs and protect the brain. That's in case if they had to have a more premature birth and the lungs weren't like fully developed yet. Immediate delivery if the baby is close to full term. IV therapy, administer oxygen, fibrinogen determination, and the worst outcome would be a hysterectomy to prevent exsanguinations. Nursing interventions include placing the woman in a lateral position with the pillows like between the legs. You want her to avoid supine as it causes pressure in the vena cava. You want to monitor the fetal heart sounds and the rate, monitor maternal vital signs, and avoid doing any vaginal or abdominal exams to further prevent injury to the placenta. Okay, our next emergency is uterine rupture, and that's when the uterus tears at the site of a previous scar into the abdominal cavity. Signs and symptoms include fetal bradycardia, fetal distress, sudden pain between contractions, abnormal abdominal pain or soreness, excessive vaginal bleeding, recession of the baby's head into the birth canal. That's kind of like what I talked about in a previous video where the baby's head is kind of like a head on a turtle, how it retracts into the shell. Loss of uterine muscle tone, rapid heart rate, low blood pressure, and shock in the mother. Hematuria, loss of station in the fetal presenting part, and an irregular abdominal wall contour. Treatment includes possible surgical removal of the woman's uterus if there's major blood loss, blood transfusions, administering oxygen, delivery by cesarean section, laparotomy to basically see what's actually going on with the uterus, repair of the uterus if possible, administration of antibiotics, blood draws, and we would want to restore circulating volume with IV therapy. Nursing interventions include informing the mother on the seriousness of this event, reassure her that staff will be working quickly to ensure the health of her and the fetus, monitor for possibility of uterine rupture. That's where you would, of course, get your assessment to find out maybe she's had previous uterine scarring, so that therefore is a risk factor for it. You want to assist with any rapid intervention like a C-section or, for immediate vaginal delivery. You want to monitor mother's vital signs, monitor the fetal heart rate, and insert a urinary catheter for precise determinations of her fluid balance. And lastly, we have amniotic fluid embolism. And that is when amniotic fluid containing particles of debris such as hair, skin, meconium, or vernix, which vernix is basically the white biofilm on the baby that kind of helps protect it. And any one of these things enters the maternal circulation, and it restricts the pulmonary vessels, resulting in respiratory distress and circulatory collapse. So signs and symptoms include hypotension, hypoxia, coagulopathy, difficulty in breathing, cyanosis, uterine atony with hemorrhage, seizures, tachycardia, coagulation failure, which, sorry, that's repeating. That's basically, if you see like bleeding gums, vaginal bleeding, anything like that. Disseminated intravascular coagulation, the DIC, adult respiratory distress syndrome, pulmonary edema, and cardiac arrest. So treatment includes administering oxygen again, and this one's especially critical because it's such, basically it's just a really bad sign. Like a lot of mothers don't make it through this. And there's really no signs that let you know that's what's going on. So resuscitation and 100% oxygen is like a huge deal, which that could mean they also may possibly have endotracheal intubation and have mechanical ventilation assistance. Also IV fluids. You may give inotropic agents to maintain cardiac output and blood pressure, oxytocic agents to control uterine contractions, the administration of steroids to aid / control the inflammatory process. You want to control the hemorrhage, any hemorrhage or coagulopathy. You want to do some blood studies, administer vasopressors, and a blood transfusion if needed. Nursing interventions include implementing seizure precautions. You want to monitor vital signs, skin color and temperature, monitor for signs of coagulopathy, which I said before is like the vaginal bleeding, any bleeding from the IV site, or bleeding gums. So you just definitely want to make sure that the mother is careful not to cut herself or anything like that by accident, especially if she's having that issue. You want to explain what is happening to the mother and the family and what therapeutic measures will be taken. You want to encourage the family to express any feelings they may have and provide support. And lastly, if need be, say she's just in the floor in a mother-baby unit or something like that, you may want to transfer to critical care for intensive observation and care. And that's all I have. So like I said, I will upload this chart along with this presentation. Thank you.